MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you.
Connecting Marylanders to their government. This is State Circle.
Good evening. Welcome to State Circle. Coming up tonight, are local hospitals ready for the coronavirus? And we'll see how local public broadcasters are gearing up for home learning. But first, this week, Governor Hogan has announced that 60 nursing homes and long-term care facilities have at least one case of the virus. The governor signed legislation expanding access to telehealth services. And the state says that 84,000 Marylanders filed for unemployment benefits in just 1 week.
I want to be very clear. We now have widespread community transmission. This virus is everywhere, and it is a threat to nearly everyone. 50% of the confirmed cases of COVID-19 in our state are patients younger than 50 years old. And more than a quarter of the Marylanders who are hospitalized are under 50. 335 Marylanders in their 20s are positive for COVID-19. 485 Marylanders in their 30s have tested positive, and 509 people in their 40s have already tested positive in Maryland for the coronavirus. Sadly, we have 5 infants who have been infected, including a one-month-old. The reality is that this disease does not discriminate, and no one is immune.
For the latest official information, visit coronavirus.maryland.gov. Joining us now, Bob Atlas, the CEO of the Maryland Hospitals Association. And Bob, let me just start with everyone's admiration for the work of all of the staff members at your member hospitals. They're putting themselves in harm's way, and it's important and it's an inspiration.
Well, thank you. I'll say on behalf of the more than 100,000 people of Maryland who work in hospitals, it's really appreciated. All the positive messaging that they can get is really needed, because they are either already experiencing or about to experience some serious challenges.
What are you hearing about those challenges? What's the status of the system right now?
Well, there's about 2,000 confirmed positive cases in Maryland. About a third of those maybe have been through hospitals. That doesn't sound like a lot, but it's already starting to put some pressure on some of our hospitals, in that in a few locations, hospitals are starting to fill up with the combination of COVID and non-COVID cases. There's concerns, obviously, about the personal protective equipment that everybody's been hearing about. It's true, because there's so many people who need to be tested, need to be ruled out. And all of that requires the gear to be available so that even the non-positives can be dealt with. We're also, I'll just add that, as we look at the surge, I think that we are seeing, we're having a good success on building out bed space. Hospitals are getting creative. We've got a good partnership with the state officials who are doing bed planning and looking to make space, free up space. So I think we'll have the kinds of beds that we need. The real challenge when the surge hits is going to be the staffing, because there's only a limited number of people, and people who you might call as reserves in an emergency are really already working in many cases. So we're going to have to stretch the staff a bit, and we appreciate the governor's executive orders that have allowed, for instance, people with expired licenses or out-of-state licenses to come back into Maryland and practice, as well as changes to scope of practice rules that allow people who are licensed to do one level of care to maybe expand their reach in the emergency.
What's the answer on the personal protective equipment shortage. We've seen these pictures from other states of nurses wearing trash bags. And, if the big concern is getting staff members to volunteer to work more, work harder, work in fields that they're not used to working in, they got to be protected. The national stockpile didn't turn out to be much of a stockpile. So we need people to make things. Is there somebody who can coordinate that?
I think everybody's doing what they can. The state is working hard to coordinate efforts. Our universities have started looking at ways to do some quick turnaround manufacturing. I know of one hospital system that has launched basically a sewing factory to make masks and other items. And so, it's a little bit, dare I say, haphazard, random right now, but everybody's moving in the right direction. And I don't think we're at the stage that you're seeing on the national news like New York and Seattle, where the equipment is totally gone and they're really fashioning things out of other materials. But we're running low, and really what we're dealing with is the need to surge, and need to prepare for the surge.
You represent big city hospitals, you represent small community hospitals. What are you hearing, different parts of the state, different parts of the network? Where are the stress points right now?
Well, it looks like right now the National Capital Region might be the one that's heating up first. Of the roughly 2,000 cases, it looks like about 40% are in Montgomery and Prince George's counties. Now that's 2 million people, 1/3 of the population of the state. So a slightly higher proportion of the cases are in those two counties. But Baltimore County, Baltimore City also are showing substantial numbers as well. The outlying areas, have some cases, but are not yet in any kind of overwhelmed state.
And then I've read that a lot of the emergency departments around the country are actually empty because nobody really wants to go now, out of fear that the hospitals are full of coronavirus people. Is there financial stress on the system from all of the elective procedures that have been canceled, and the idea that if people can help it, if it's not a heart attack or a stroke, they're trying to avoid coming into the hospitals?
Yeah, you put your finger on it, Jeff. The volumes have actually gone down considerably. I've heard from hospital executives, emergency department volumes may be down 40, 50% in some places. Inpatient volumes are down as well as a result of the cancellation of elective procedures and things like that. So it's actually a financial hurt to hospitals, which of course impedes their ability to focus on patient care. There's a revenue loss that's occurring along with the buildup of expenses because hospitals are spending a lot of money and getting ready for the surge, buying more equipment, buying ventilators, buying beds, paying overtime for staff, and so many different things. So the expenses are up, the revenues are down somewhat. And it's going to be a pinch. We're grateful that the state and the federal government recognize this, but the distribution of dollars that are being made available is uncertain as to amounts and when and who will get it. So we are a little bit worried.
I've seen all sorts of different numbers for how many beds we have in hospitals in Maryland. Is there a single answer to that?
So it depends on how you count. So hospitals are licensed for a certain number of beds, but that doesn't mean they operate all those beds. So you might have heard a number sort of north of 9,000. That's the number of licensed beds. The number of operating beds in normal times prior to this crisis was about 7,000. That doesn't mean that we are short any beds. It's just that there's always a a difference between operating and licensed beds under the regulatory system that we have. And we are working on surging that 7,000 up to as much as 12 or 13,000 total. Some of those additional beds won't be traditional hospital beds, even in traditional hospital settings. But for the most part, our hospitals are trying to grow capacity within their walls, because that enables them to manage the patients more closely, to let the doctors and nurses round on the patients more easily.
I read, Bob, that you started a career in public health. From that perspective, what do you make of this situation? What do you think is the long game here? After we hopefully manage the surge, what comes next?
Well, we're going to have to do a real stock taking, so to speak, to figure out how we emerge from the crisis, how we rebuild our healthcare system so that it can withstand this kind of emergency again in the future. Nobody really predicted this, but I think that everybody could have prepared better. We've had a world for the last 30 years where hospitals have been seen as too costly and to be avoided for various reasons, mostly by the payers. That's understandable from their perspective, but we have to have a system that can really flex to meet these kinds of emergencies. And so we're going to have to figure that out. And I think we're going to have, by the same token, we're learning how to better use things like telehealth, which has been around for a number of years, but its adoption has grown somewhat more gradually, and now it's becoming widespread because the Medicare program and other payers are saying, well, we want people to stay home. We want them to be able to consult with their doctors remotely, so we're going to pay for it. So that's a good thing. And, these changes won't be undone, and we ought to look at how we can really modernize our system.
Bob Atlas joining us. Bob, thank you very much for the time.
You're most welcome, and stay safe.
You too. State Circle continues right after this.
Can you tell us what you know?
Turning back now to the race for the White House.
The State Board of Elections voted Thursday to set up a new election.
It must be a very emotional day.
The world changed in the blink of an eye.
Children are at the heart of this story.
Now, with schools closed around the state, students are getting up to speed on home learning, as Nancy Yamada tells us.
At Urbana High School, the 6 feet social distancing rule applied as parents left the safety of their homes to line up to get Chromebooks or laptops on loan for their school-aged kids. The line here stretched around the entire campus, but few people were complaining.
I have a 10-year-old, a 8-year-old, a 7-year-old, so 4th grader, 2nd grader, and 1st grader. There's no problem standing in a line. We actually thought it'd be more efficient, maybe go through a car, pick it up. But I'm actually very proud of all my neighbors here. We're all spaced out, so I don't mind it at all.
This was the scene being repeated at every high school in Frederick County and at schools across the state as school districts get ready to teach kids remotely for the next 4 weeks. The computers, along with designated Wi-Fi hotspots, are being made available to every child so learning can continue for the duration of this unprecedented shutdown.
I think it's a good idea to keep kids safe until we figure out what's going on with the coronavirus and everything. Just giving them activities at home to keep them engaged.
How do you think the school district has done in response to this quick shutdown and now prolonged shutdown?
I think it's very wise of them. States across, school districts across the whole country have shut down even a week ago. They shut down all the way until summer. So we're all just waiting, when is Maryland going to do it? When are they going to cut and shut down and extend it? Just the health and safety is most important.
I'm Nancy Yamada for MPT News.
Help for parents and students is also on the way from local public broadcasters.
In response to the coronavirus crisis and in aid of students, parents, and our Maryland teachers, MPT is devoting its broadcast day to at-home learning, featuring 3 distinct blocks of educational programming targeted to early learners, the middle grades, and high school. At-home learning on MPT starts Monday, April 6th.
Public television stations in the Maryland, D.C. area are changing their daytime programming schedules for something called an at-home learning initiative. We are joined by MPT's Vice President for Education, Jeff Salkin. Betsy, tell us what's happening and when does it happen?
Hi, Jeff. Thank you. I'm really excited to be here to share the at-home learning initiative. Education is at the core of MPT's mission. And right now, my goodness, our daily lives are turned upside down as this public health emergency has just left us at home. And people are at home, their children are at home, and there could be a significant learning loss. So as a public television station, we have an immense amount of really stellar and trusted content, both television programs as well as online content. So we have joined together to do a multi-pronged program. We've joined along with WETA and WHUT, which are DC-based stations, and we are coordinating broadcast schedules from 7 a.m. to 5 p.m. To help serve the education needs of families in the region with really accessible, high-quality content. So we have coordinated program schedules for pre-K through grade 12 students. So there's blocks of programs. Some of the blocks serve a pre-K 3 audience. That would be like the PBS Kids programs. And then we have a series of programs that are geared toward the subjects that are taught in the middle grades, which are grades 4 through 8. And then we have another series of programs that serve the subject areas and topics that students in high school learn. And we've coordinated an immense amount of programs across the 3 stations, but not duplicative. So no matter which station you watch, you'll be able to get a series of programs to serve somewhere within that spectrum of pre-K through grade 12.
So, I mean, as you mentioned, the great thing about public television, and since the beginning of public television, it's over the air, it's free. If you have a TV set and you're in range of one of our 6 transmitters, you can just tune in. However, the programming you're talking about is very different from what people might remember if they tuned in to educational material on PBS stations 40 or 50 years ago.
Yes, this is true. It's not going to be a teacher's lecturing. It is, it's content that is oftentimes primetime programs. So it could be a NOVA, and it's talking about about the planets, or an American Experience that's looking at the pandemic, the influenza epidemic in 1918, or Shakespeare Uncovered, if students learning about Shakespeare. So it's really, it's wonderful programs with tons of learning baked in. And what we do is we have supplemental online resources that can be used either online or offline, but it's instructional content that can be used by a teacher for supplemental learning, or for parents if parents need some strategies of how to talk to students or their child about the program that they watched. so that they can really engage them in pulling out those wonderful learning nuggets that are all throughout the show. So we have viewer guides that are complements to every show.
Where can parents find that information? And obviously there are all sorts of different situations out there. Parents who are working full-time, parents who are not, they might be working from home. They might have an educational background, they might not. What are the expectations for how parents are going to be able to make the best use of this?
Well, first let me say that what's significant about what PBS and what MPT can offer, all the public media stations, is equitable access to learning. Because like you said, parents are at home and the situations are certainly not all the same. Some homes don't have internet, some homes don't have devices for students certainly to have all day to do classroom lessons. You can't move a classroom home. You have to learn, you have to move the learning home. So by having a broadcast of these high quality programs across subject areas, we're moving the learning into the home. And then we help parents by offering viewer guides and strategies and lots of different resources and supplemental learning for teachers on mpt.org/education. And that will take you to MPT's education website for teaching and learning called ThinkPort. And on ThinkPort, there's lots of online digital resources to support not just the broadcast programs, but an array of topics and subjects, K-12 across the board.
Maryland has 24 different school systems, and I imagine they're all gone in different directions to some degree with this. How do you anticipate this might integrate with what a certain school district is doing, and maybe how does that affect what parents might want to do with all this material and all this programming?
Well, we're working closely with MSDE. They're very supportive of our initiative, and they'll be sharing our programming grids and the online resources with the school districts across the state, as well as the early learning, which is equally important. We have this wonderful programming from age 2 to age 8. They call it pre-K 3. So the programming and all the information will be shared with the school districts, and then the teachers, depending really on what their remote learning situation is, have access to these resources. They also align there's another website that ThinkPort also works with called PBS Learning Media, and on PBS Learning Media, all the resources align with standards and all the things that are important whenever you're developing your instruction. So teachers have access to all this to be able to use what we have as a supplement to their lessons.
Right. The best starting point is mpt.org or just tune in starting on Monday.
Yes, and you can watch over the air. You can watch on your cable system. You can also, if you have a device and you want to stream it, you can go to mpt.org and stream the broadcast as well.
Very good. MPT's Vice President of Education, Betsy Patesock. Betsy, thank you very much.
Thank you.
Maryland now has several coronavirus testing locations for people who have been referred by their doctor and have made an appointment. Our Charles Robinson visited the Glen Burnie location.
We want to let you know that this is where people can come in, but you have to have an appointment in order to do that. The process is pretty simple. You are to keep your windows up as you drive up. They will then direct you, as you can see behind me, to where the National Guard is stationed. They're going to allow you to go into the actual bays where they actually do the swabs. And after that, you will have to wait a while before you get the results of your tests.
We learned what it was like to be tested from Ramado Garcia.
It's very, very smooth. It's very controlled. I like the fact that there's no ambiguity. which lane you're going to go through, how you're going to do it. So it is a very professional and very well done.
Charles, thank you. That is our program for this week. Remember, updates on all of our programs available at mpt.org. And please follow us on Twitter at MPT News. Now for Charles Robinson, Nancy Amata, Sue Copen, and all of us at MPT, thanks for watching, be well, and have a good night.
This program was made by MPT to serve all of our diverse communities.
TV Worth Watching is supported by the members of MPT and by...
What's your next move? Make inroads into the education field or advance your current teaching career through UMBC's professional master's programs and certificates in education, instructional systems development, college teaching and learning science, and TESOL. UMBC students gain their skills through rigorous coursework paired with real-world experience at local K-12 public schools. Our community is committed to seeing our graduates grow and build connections through teacher-led professional networks. Claim your future at UMBC.
71 acres in downtown Baltimore devoted to learning, discovery, care, and service. We train the professionals who secure the health, well-being, and just treatment of Maryland citizens.